Hello, friends. Today we are going to learn the topic that not only confuses students in exams but also confuses ophthalmologists in clinics whether this is a scleritis or episcleritis. I will clear it once and for all in today's class with one diagram that you will remember forever. So today's class will be divided mainly in three parts. One will be concept, second part will be how to write the answer of this question in exams, and third how to differentiate clinically episcleritis from scleritis. So let's dive in. So this is the conjunctiva, this part. This is episclera, black line which we are seeing, and this is the sclera. Now we all know what is episclera. In my last video, I have teach you what is episclera. This is conjunctival vessels, this is superficial episcleral plexus, and this is deep episcleral plexus. So, conjunctival vessels are located inside the conjunctiva. Superficial episcleral plexus is located beneath the episclera but in the superficial layer. Deep episcleral plexus is also located beneath the episclera, but it is located in the deep layer. So that's why it is called deep episcleral plexus and not the scleral plexus. The episcleritis is inflammation of the episclera. So this part will get inflamed in episcleritis. Along with inflammation of episclera, dilatation and congestion of superficial episcleral plexus. And in scleritis, along with inflammation of the sclera, inflammation and edema of the sclera, there will be dilatation of deep episcleral plexus. So, third point, what is the color of the vessels? As you can see, the conjunctival vessels are bright red in color. Superficial episcleral plexus are salmon pink in color, and deep episcleral plexus are purplish or violaceous hue. Why it is so? Now understand. Vessel color usually is a red color, but in this episcleral plexus, above which is the connective tissue fascia and the conjunctiva. So, if we are looking from here, the color will look little bit darker. And in scleritis, this deep episcleral plexus, the conjunctiva, episclera, and here the stroma will also be there. So the color will be little more darker as compared to this. So superficial episcleral plexus will be darker than this. Deep episcleral plexus will be darker than both of this. Now the arrangement of vessels. As we can see, this conjunctival vessels, these arteries are tortuous and veins are straight. Okay. Superficial episcleral plexus, they will be arranged radially. They will go like this. So this is the limbus. The vessel will go like radially. And deep episcleral plexus, this pattern is crisscross pattern. Okay. Location of inflammation. Episcleritis is a superficial. Scleritis is a deep inflammation, deep-seated inflammation. Which episcleral plexus get involved in episcleritis? Superficial episcleral plexus, scleritis, deep episcleral plexus. Color of vessels and arrangement of vessels. Arrangement of vessels, superficial episcleral plexus and deep episcleral plexus. Now, we will modify this image to understand the further points. So in scleritis, as I told you, along with the inflammation of sclera, there will be dilatation of episcleral, deep episcleral plexus. So there will be edema of the scleral tissue. There will be stretching of fibers, stretching of scleral fibers. So patient will have pain. Episclera is a fascia, Tenon's fascia, while sclera is a much thicker and connective tissue layer rather than to episclera. So when the sclera gets inflamed or edematous, there will be much more pain. So when the pain is very important differentiating feature between scleritis and episcleritis. As in episcleritis, patient will have very minimal pain and discomfort. Discomfort will be the main symptom of patient, while in scleritis, pain will be the main symptom of patient. And not only that, when we touch the eyeball of patient for examination, patient will scream in pain. Okay, and that we call as the tenderness. So this is very important differentiating feature, not only in exam but clinically also, to differentiate between scleritis and episcleritis. Now we have to modify further this image. Now this is the phenylephrine drop. Phenylephrine drop will blanch the superficial conjunctival vessel. 2.5% phenylephrine will blanch the conjunctival vessel, but it will not blanch superficial episcleral plexus. For that, we need higher concentration of phenylephrine, that is 10%. 10% will blanch superficial episcleral plexus, but none of it will blanch the deep episcleral plexus. As you can understand, the layers are deep, so it will not blanch the vessels because there will be more connective tissue and stroma above lying that. So that comes us to important topic, important point, that is blanching of vessels by vasoconstrictor. An episcleritis vessel will blanch with 10% phenylephrine, while scleritis vessel will not blanch even with 10% of phenylephrine. We just have to remember this drop can penetrate till here, but it cannot reach till here. Okay, with this just one drop image, we can remember this point. Now we'll further move on to the next point, that is, if now the patient is having scleritis and we know that this can topical treatment cannot penetrate and reach up to this deeper layer. Now if the inflammation is here, and in ophthal we know the most of the treatments are in the topical treatment, but if the drop is not reaching till here, now what will give? So here comes our systemic medication. The systemic medication will only reach up to here and will, because the vessels are here, so the drop systemic medication molecules will reach here and the scleritis will get treated. So the important differentiating point in the treatment is episcleritis will need topical medication. It can be cured with topical medication, while scleritis need systemic medication. S for S, scleritis will need systemic medication. So remember this guy. Okay. Now we'll come to the next point, that is association of systemic condition. In episcleritis, as we have seen, that in recurrent episcleritis also there will be 95% of the cases will only have, while in sclerity majority of the cases will have systemic condition associated, that is connective tissue disorder, rheumatoid arthritis, reactive arthritis, and SLE. This all will be associated with scleritis. Okay. Now I'll move to the next point. We apply this cotton bud and move this conjunctiva. The vessel will also move along with that. So, because this episclera is a fascia is relatively thin tissue, so it can get dragged with the cotton bud, while sclera is a tough and anchored fibrous tissue. So, for the movement of vessels with cotton bud application, episcleritis moves, scleritis does not move. Now, we'll come to the final image that we are talking about. So in exams you just have to remember this image. Now we have come to the second part of it. So we have 9 differentiation points with this image only. We have to draw conjunctiva, episclera, sclera, conjunctival vessels, superficial episcleral plexus, deep episcleral plexus. And the color also you just remember bright red, salmon pink, and violaceous hue or purplish. Okay, that alone this image will give you 4 points. What are these 4 points? The level of inflammation. As we know, episcleritis is a superficial, scleritis is a deep. Second is the which episcleral plexus get involved. Superficial, deep. Arrangement of vessels. Radial, crisscross. Color, salmon pink and violaceous or purple hue. The fifth point, that is the scleritis will have edema of tissue. The patient will scream in pain. Sixth point, phenylephrine drop will blanch this vessel, will not blanch this vessels. 7 point, If the treatment is not getting reached, then we have to call this systemic medication. So episcleritis topical treatments, scleritis will need systemic medication. Systemic. So scleritis will have associated systemic condition, while episcleritis will have rarely any systemic association. And the ninth point is cotton tip applicator. Episcleritis moves, scleritis will not move. Okay, so screenshot this image, remember this image. This will give you 9 points to how to write this question's answer. Now we'll move on to the third part of video, how to differentiate scleritis and scleritis clinically. This is the image of episcleritis. So as we can see, the inflammation looks more of superficial. The color of vessels, you can see this is salmon. These are conjunctival vessels. The red you are seeing is beneath that. If you look very closely, you can see this salmon pink radially arranged vessels. Okay, they are episcleritis. Okay, so and the other test will do. This is the scleritis picture. You can clearly see this purple violaceous hue. Okay, and the vessels are mainly crisscross, so they are very crisscross that we cannot differentiate the arrangement. It lesion. Okay, now we'll see other points how to differentiate it clinically. Slit lamp examination will do with green filter so that we can appreciate the depth more properly, and if it's able to do in natural light, we also have to examine. Okay, so the slit lamp examination with green filter, that will show us the color of vessels, level of inflammation, and all the things. Okay, then cotton tip applicator, movement of the vessels, we have seen. Phenylephrine test, this will do when we are applying phenylephrine, that for dilatation, 1 drop phenylephrine you have to put, and we can see the blanching of vessel in episcleritis, while in scleritis that will not blanch. Pain and tenderness while examining, that will also give the major clue. And after diagnosing if it is a scleritis or episcleritis, if it is scleritis, we have to investigate for a systemic causes and simultaneously start treatment with systemic medication in case of scleritis. So for S, remember systemic causes and systemic medication. Okay, so this was all about the scleritis versus episcleritis. Thank you for your time and patient listening. I'll see you in the next video. Till then, goodbye and happy learning.